So the CoMMpass study is going to be really important moving forward. We all know that different myeloma patients respond to treatment differently, but also present with different forms of myeloma, so maybe lots of bone disease or lots of kidney disease. And it's only by looking at a large group of myeloma patients, so over 1,000 or more, that we can actually get to the bottom about why patients get myeloma and why patients respond differently to treatment. The CoMMpass dataset will help us answer lots of questions, not only about the biology of myeloma, but also about the treatment of myeloma. And I'm particularly interested in some of the treatment questions. So that would be, why do some patients respond better to a proteasome inhibitor? Or maybe why do some patients respond better to transplant than others? I think also there's many of the new therapies coming along, so hopefully it'll help us identify which patients might respond best to an antibody. The other things that will help us from the treatment side will be maybe about side effects. Why do some patients, for instance, get neuropathy when they're treated with proteasome inhibitors? And then I think the final area on the treatment side of things would be there's lots of excitement now about maybe being able to give vaccination for myeloma patients. And by looking at a large genetic database, such as the CoMMpass database, we might be able to figure out which patients would do well with a vaccine, and indeed how we could personalise a vaccine for a specific patient.